All right, why don't we get started, at least with my easily missed introduction here. It's Gerry, Rosberg is my name. We're back for the latest in this continuing series. We have our regular panelists here. I'm guessing that most of you, and thank you for so many of you coming to join us this afternoon. I'm guessing that most of you have been to more than one of these sessions already. We'll dispense with introductions so we can get straight to the substance of this. We're going to have some brief presentations and then Q&A as of the sort we always do. Please, if you have questions, put them in the Q&A box. Our expert panelists will do this amazing job of answering your questions, both in writing and orally at the same time. It's a mystery how they do it, but they do. We also have two special guests today, David Greenberg and Amador Centeno, who are both very, very involved in preparation of facilities, which we know is a subject of real interest to those of you who have not been on campus, but are about to come back. But let's start. We have a brief survey, not a quiz, but a survey. And Robert, I'm hoping you'll put that up and let everybody see. I think it's just 3 questions today. So please, if you would, we've had trouble in the past. You do have to answer each question to go on to the next. If you don't want to answer the question, click the box called not applicable. That will let you advance. So let's see, your 3 primary sources. So 75% say campus-wide emails, then return to campus forums, webinars. This is very encouraging, and 38% say emails from my dean or department unit leader. We, especially Donna and I, have sent out so many emails that we're worried nobody is reading. That to see that great number for campus-wide emails, Donna, I hope it's true for you too, but that warms my heart to see that. Thank you. About which topics do you feel well informed? So the vaccinations, a very high score, COVID-19 transmission and disease, mask protocols, not so strong, classroom instruction, events, gatherings, travel in US or abroad, and other. Well, again, I have to admit, I mean, you've correctly picked the hardest ones and for those low recognition. And then finally, about which topics would you like more information? The number 1 answer there is campus readiness, followed by events, gatherings, and mask protocols. Okay, so let us digest all of this and put this to good use. But we'll proceed. I think next on the program is Donna. Remember to put your questions in the Q&A. If we can't answer them here, we'll do our best to follow up on them. But Donna, over to you.
Great, thank you. And you actually teed up what we're going to feature. As Gerry mentioned, we have both David Greenberg and Amador Centeno here to, in fact, talk a little bit about campus readiness, our facilities, our transportation, and overall what the campus is going to look like. So I think this lines up perfectly, and hopefully we'll meet some of your concerns during the prepared remarks as well as the Q&A. So let me just share my screen. Oops, sorry. Let me just share my screen. Second, out of practice. Sorry, I've got a bunch of things open that I shouldn't have open. Okay, hopefully everybody can see it. Sorry, it took a couple.
We got it. Good.
So I want to just for a couple of minutes, I have a few short slides, talk a little bit about what's going on nationally and locally, because there clearly has been an increase in COVID positivity and in transmission. We've seen a tiny increase on the campus. I think we have to continue to come back to what does the campus look like and how has it been between our rigorous testing program and because now of the high compliance with the vaccine mandate This campus has been for the last 17 months and will continue into the fall to be incredibly safe. So there's lots going on in the world outside, but we want to assure you that the safety protocols, the testing regimen, and obviously the vaccine mandate are keeping our campus safe. So if you look at the next slide, this is to give you a sense of how different, quite frankly, the United States right now is than New York, although we have seen some increases in cases in New York. So but about at the end of June, as you may recall, the governor and the mayor relaxed a number of conditions around the city and the state. We are seeing a little bit more of a tightening, but again, Columbia has always been consistently more conservative, and I say that in a positive way, when it comes to the various safety protocols that we have in place to keep our affiliates safe. So just the more important graph is what you see here in New York. Again, a similar uptick since a low that occurred around June, excuse me, in particular. But if you notice carefully, you know, a peak that's not quite as high and the beginning of a little bit of a drop off that we hope is going to continue. The hospitalizations in New York and the cases in New York have been increasing since June. These are mostly mild cases and overwhelmingly amongst the unvaccinated. Those are two important things to remember. And of course, our own vaccine compliance in New York State is one of the ones I think we can proudly look at across the nation. We are approaching 80%. It's going to take us maybe a few more days to a week to get there, but we are, you know, high 70s in terms of vaccine compliance. So as I said, on the campus, as many people prepare to return to 2 or 3 days a week, or maybe even more, and certainly our students are preparing to return. We have several schools that are commencing this week, from our business school, our law school, our journalism school, and on the medical center, 3 of the 4 schools up here are actually starting in August. So we're well underway in terms of, again, not just keeping the safety measures that we've had in place, but also watching what else is going on in the community. Wafaa is going to talk a little bit about our monitoring plan, but literally on a daily basis, we have groups who are evaluating what's going on in the city, in the hospitals, so that we can decide whether or not we increase or we decrease, in some cases, the safety protocols. There are 4 things you have to remember, and I think Melanie is going to touch on those for those of you who have not been on campus. And even some of these apply to you if you have been on campus. There are 4 things that you need to do, and just keep reinforcing this with your staff and with your colleagues. One is complete the vaccine requirement. The second, which went into effect yesterday, is what we call a re-signing of the Columbia University Compact. You all should have by now the Reopen CU app, which is your daily gateway to come into the university and to make sure that you don't have any symptoms. But it also allows you to mirror this checklist of things, the vaccine requirement and the compact. Today, you should see at the top of your screen, and this is for everybody. Now, I've already completed my compact, but at the top of your screen is now a red bar reminding you that you need to re-sign the compact, even if you signed it previously. So please do that as soon as you can. We have training that's required for people who did not previously take training in 20 or 21. If you took the training and you remember that, you don't have to do it. And the easy way to look at this is to look at what is on your Reopen CU app under my checklist. And if it says my training is completed and it's checked, you're good. If it's not, you must retake the training. And then the 4th that Melanie is going to get into in a little more detail is our university COVID-19 testing requirements. So coming back to the campus for the first time since January, you must undergo what we call a gateway COVID PCR test. either at Lerner Hall or in the Black Building on the CUIMC campus. And then there's subsequent surveillance that we'll talk about as well. And then the last thing I'll start framing a picture, excuse me, of what the next couple of weeks will look like. And as I said, Amador, David, and others will comment on it. We are bringing back tens of thousands of students, and there will be not only move-ins with family members, those will all be fully masked and with limited ability to go into other non-relevant buildings that the family members or those assisting in the move do not need to go into. We are doing this in a fully masked way, almost exclusively outdoors, from an orientation and from also a convocation perspective. We know that as the semester gets underway, individual departments and others will want to have events. We have a very strict event policy. It's on our COVID-19 website. And there are some very formal approval processes, again, trying to keep the campus safe. We have other visitors that we know come to the campus as it's normally open, whether they are family members, whether they are friends, whether they are visitors who have an academic purpose. There are protocols with respect to the entrance of all of those individuals onto the campus. And then we've also allowed some resumption of travel. There are travel guidelines for the fall that are posted on the website, but there are some clear restrictions and approval processes that people have to go through. And then there's three important changes for those of you who have listened before or who are reading the emails. The situations evolve pretty rapidly, as you're well aware. So one change in policy that's gone into effect in the last 2 weeks is we had anticipated that as we got to a fully vaccinated campus by September 9th, that we would eliminate face covering for persons who were vaccinated indoors. We have made a decision not to do that now. We want to be extra cautious. And so we will continuing face covering indoors in all locations, except obviously when you're in a private office. And that will continue whether you are vaccinated or not vaccinated, and it is true for faculty, staff, and students. The only exception to that policy is in an instructional space, a faculty member with appropriate distancing can teach with their face covering off. The second decision that was made, we had a voluntary testing program for the last year that allowed Columbia affiliates to get tested when they have no symptoms, but they are concerned about whether or not they're COVID positive. That testing program is now going to continue through September 30th. And I will tell you that as of just yesterday, we began through Columbia doctors to offer booster shots for the immunocompromised individuals that Wafaa will discuss in terms of the criteria. And so you are able, if you fit into these categories, to reach out through the Columbia Doctors website and through our phone numbers to schedule a third or booster shot for both Pfizer and Moderna. We expect, quite frankly, looking ahead, and many of you saw the news, that the administration in Washington announced that it is likely to see a broad expansion of booster shots to more than immunocompromised individuals over the next several weeks, and we are preparing for that as well. So I'll stop sharing, and I'm going to turn it over to Wafaa.
And thank you very much, Donna. And let me share my screen. Does this look okay, Gerry? Okay, I'll get started.
Looks good.
Okay, so I'm going to focus on an update on vaccines and viral variants specifically for all of you. So first of all, I think just to contrast what's happening in New York City versus what's happening in the country overall, and as Donna mentioned, we can be very proud in what has been accomplished in New York City, and this is focusing just on adults, with 74% have received at least one dose, and about 68% have been fully vaccinated. We still have a group, of course, about a quarter of our adult population that still need to receive at least one dose. And you can see that we contrast quite well when compared to the overall US coverage in terms of vaccine. And I'll get to that later on as to the implications of vaccine coverage for the epidemiology of COVID-19. So what's been happening in New York City, as Donna mentioned, there's lately been an increase in cases. And this is another way of looking at the data. And this is actually looking at the 7-day total numbers of cases adjusted for the population size in the city overall in dark blue, and then different boroughs in the lighter blue. The top one here is Staten Island. And what you can see is there are encouraging data over the past several days that we have peaked. And in terms of this latest surge in numbers of cases, you can see the beginnings of a drop in this very important metric of transmission. And we're even seeing it plateauing in Staten Island. So let's move on to variants. I think one of course, the issue that's been dominating the conversation has been the Delta variant. And I'm sure all of you are aware, when you look at the US overall over the past several weeks, there's been increase in this orange kind of proportion, which is telling us that this is a predominance of about now 84% of all viral isolates that are sequenced are Delta variants. And then when you look at New York City, you'll see again that over now, currently at this point in time, the Delta variant in this light blue is the predominant variant at more than 95% of all viral isolates that are sequenced in the city. And the reason we're concerned about this, important reason, is transmissibility. I think there's no doubt that this variant is more contagious, meaning more transmissible. And we have one metric that we use, which is the average number of individuals to which an infected person will transmit the virus. And you can see here with the original Wuhan strain, it was to 3 individuals. With the Delta variant, it is to 7 individuals. And then you can see other highly transmissible viruses like chickenpox, mumps, and measles. They're much more contagious than even the Delta variant. But why is it important? I think it's important because I think everybody is asking this question of the hour is how effective are our vaccines against this Delta variant? And this is one study that shows, that looked at the effectiveness against Delta and Alpha. In blue are the Alpha variant and in purple is the Delta variant. And you can see that after 2 doses here, and this is of that you can see that after 2 doses, this is with both the Pfizer BioNTech as well as the AstraZeneca vaccines. And what it shows us is that with the Pfizer vaccine, that it's effective at about an 88% vaccine effectiveness against the Delta variant. With the AstraZeneca vaccine, which is not available in the United States, it's about 67% effective. And there also are data on the Johnson & Johnson vaccine, which I know some of you may have received. We have very encouraging data now from South Africa. This is a very large study that included almost 500,000 healthcare workers. And the findings show that for the Delta variant, there was 71% protection against hospitalizations in association with the Delta variant. So let's talk about post-vaccination, or what some people have called breakthrough infections. So there's been a lot of interest in this, and there are data that are accumulating. And here you'll see data in black against the Alpha variant, the old variant, the UK variant, versus in red, the Delta variant. And several studies have been published from a variety of different countries around the world. You can see here, again, in red, let's focus on the red, in the triangles in red, and you can see here again protection, almost 79% protection against any infection, 88% against symptomatic disease, and 96% against hospitalization. Similarly, 85% protection against symptomatic illness in Canada, and 100% against hospitalizations or deaths. And Qatar also using Moderna, now these were Pfizer Moderna vaccine, again showing 54% protection from symptomatic illness, 90% again protection against hospitalizations and death. Now the outlier has been Israel, and it's unclear why that is, but nonetheless you can see that again in Israel that utilized largely Pfizer vaccine, 91% vaccine protection against a severe illness with the Delta variant. So we have reassuring data based on these large population kinds of studies that have been done. This is another study that was published recently from the Mayo Clinic, and it's looking at SARS-CoV-2 infection and SARS-CoV and COVID-19 hospitalizations. And you see in orange is Moderna effectiveness, and in Pfizer, and Pfizer in blue. And you can see here that, again, this one shows that about 42% protection against infection, while Moderna was 76% protection against infection. But nonetheless, when you look at hospitalization, which is what we all fear is severe COVID-19 illness, you can see here 75% protection by Pfizer and 81% protection to Moderna. So the data are all over the place, but I think they largely are telling us that these vaccines appear to be protective against hospitalization, severe illness, and less so, but nonetheless substantial protection still against infection. What do we know from the US overall? In comparing the COVID-19 cases, and this is cases in the United States by different states, and this website has all the different states lined up. You can see here when you look at COVID-19 cases that the vast majority, looking at California, for example, the vast majority the cases are occurring amongst individuals who are not fully vaccinated. You can see this is consistent across all these states. And if I showed you the whole website, you'll see that it's consistent across all the states. And you can see here the sliver, again, a small proportion are amongst fully vaccinated individuals. When you look at not just cases, but you look at COVID-19 hospitalizations and death, the similar findings in terms of an overrepresentation, the majority are occurring amongst individuals who are not fully vaccinated. And this is a nice map that I think shows this in a very nice pictorial way. So what it shows essentially is when you look at certain places, parts of the country, like here, I think this is Missouri. I think this is Missouri, I'm not sure. And this is Louisiana, and then Florida, and other parts of the country that are in deepest red. And the places that are in the deepest red are here. And these are the places that have the lowest vaccination rates. And they are the ones that are experiencing the highest reported cases per 100,000 population. We're fortunate where we are. We're in this green zone. And that means that we are fortunate to have high vaccination rates and low case rates. So that's kind of very important to keep in mind. So communities and the country overall is really now being distinguished by situations where some communities that are highly vaccinated have less cases, and those that have less vaccination have more cases. And you're reading about this in the media in terms of hospitals and ICUs being full in Texas, as well as in some of these other highly affected parts of the country. So what about this? Just to summarize these post-vaccination breakthrough infections, we know that we've known this from day one, that these vaccines have been produced to protect us from getting sick with COVID-19, meaning severe illness and hospitalizations and death. And therefore, it is not a surprise that vaccine breakthroughs or infections are expected and will occur. Some will be caused by variants, even if vaccine has similar effectiveness against that variant. And it's important to note that most of these infections that occur amongst vaccinated individuals have been occurring amongst older and immune-compromised individuals, and I'll get to that in a moment. But I want to also caution everyone that with increased vaccine coverage, as communities are, almost a whole community is vaccinated, of course, what you're going to see is a higher proportion of the breakthrough infections will occur amongst vaccinated individuals. So it is not unexpected that as we move forward and get more and more highly vaccinated, that a higher proportion of the cases will occur amongst the vaccinated. But the important thing is these individuals, thankfully, are not getting severely ill, needing hospitalizations and ICU care and so on and so forth. The other thing, interesting data that also people raise all the time is, I'm really worried because now if I get COVID, I'm vaccinated, get COVID, that people who are vaccinated are just as likely to spread as people who are unvaccinated. And we have very interesting data here from Singapore that show that that's not the case. Is that what they show is if you look here at the time of diagnosis, in red amongst people who are not vaccinated and in green amongst people who are vaccinated, the amount of virus in the nose, as through the nasal swabs is quite similar at the time of diagnosis, the beginning of the illness. However, you can see this green line here is there's amongst the vaccinated individuals, there's a rapid drop-off in the amount of virus that's isolated from the nasal passages of vaccinated individuals, which is very reassuring because it tells us that certainly while a vaccinated person with COVID-19 can transmit, but the period of transmission is much shorter, which is very reassuring, which means the risk of transmission, of course, is lower. I'm going to switch now and touch very quickly about issues of the vaccine response amongst immune suppressed individuals that Donna mentioned this. And this is a nice figure that shows us that here on this axis, on the y-axis, are the percent of people with an antibody response. 100% is good, right? This is like healthy controls. You can see here for cancer patients, for example, there's a spread here with some as low as 40% of them having an antibody response, but some who have a pretty good response. The darkest blue are individuals with hematologic cancers, blood cancers. Hemodialysis patients have been another group, but you can see that actually when you look at the response, it might be a little bit lower than the healthy controls, but nonetheless, it's pretty adequate. And then if you look at organ transplant, kidney transplant, heart transplant, and so on, you can see that, again, this is a group that's much less likely to have an antibody response after vaccination. And then people are immunosuppressive therapies, variety of therapies, you can see where they scatter. And it is these data here from several studies put together that then motivated the recommendations I'll talk to you about. So then there have been studies that have been done, and this is one of those studies where they took people who had solid organ transplants, and what they did is they looked at their antibody response. 100% means that all of them developed an antibody response. And you can see here this is after the second dose, this is of mRNA vaccine. After the second dose, about 40% of them had antibodies. And then this is after a third dose, 1 month after a third dose, and you can see that increase doubled to about 70% had an antibody response. So this is again demonstrating there may be the potential to give a third dose, which can then increase the proportion of people who have an antibody response after due to the vaccination. This is what motivated the CDC recommendation for a third dose for individual. This is a third dose of an mRNA, Pfizer or Moderna vaccine. So who are the individuals? CDC, after examining all the data, concluded the recommendation for moderately or severely immunosuppressed individuals who could receive an additional dose. These are individuals who have been on active cancer treatment for tumors and cancers of the blood in particular, who've received an organ transplant and are taking medicines to suppress the immune response as people with organ transplant often need that, receive stem cell transplantation again, are have moderate or severe primary immune deficiency. This is much rarer condition, have advanced or untreated HIV infection, and are in active treatment with high doses, about 20 milligrams per day of prednisone or other drugs that may suppress the immune system. Now, we also are at the same time as well, so this is the recommendation in place, and for individuals to then seek a third dose of these vaccines. There are ongoing studies. There's one study that I know of that's ongoing that's looking at what about recipients of the Johnson & Johnson Janssen vaccine. We're hoping to get soon, maybe by the end of next month, the results from that study that are attempting to do something similar to look at an additional dose for people who receive the Johnson & Johnson Janssen vaccine. We are also keeping an eye on data on waning of immunity and so on as to whether people will need a booster dose for individuals, like was mentioned by Donna, who are more than 8 months after the primary series, after the second dose of their vaccine. These data are accumulating as well. And of course, we're awaiting any guidance on this at the same. But again, even if this is the guidance comes out, we will need to also similarly prioritize people most at risk, which would be older individuals, people with comorbid medical conditions, and so on. Donna showed this for you, and I'm not going to show it again, but this is the kind of data that we look at day in, day out. New York City data in this priority listing and Columbia University data, And all of these is, this is also on the COVID-19 Columbia website. I want to end with this one slide that summarizes all the things we have in place on campus that are there for creating a safe environment. Very importantly, of course, is the required to be followed by everybody, students, faculty, researchers, and staff. Of course, the app is very critical, where we attest every day in the morning before coming to campus. Of course, the vaccination mandate is very critically important and a very fundamental piece of our protective measures. Where also the compact is very important, and the compact, of course, highlights many of these elements, but I think importantly also the compact highlights the importance of all of us observing the protective measures when we're on campus as well as when we're off campus. I think creating a safe environment on campus depends on all of us practicing what makes sense, being safe both while on campus and off campus, because actually our experiences is often in the past year and a half is often the transmissions happen socially outside the campus context. Getting tested, and Melanie will highlight this, very important. We have a robust testing program to get the training, to complete the training, and of course to wear a mask indoors by everybody. And I think importantly also, there have been enormous efforts by David and Amador that have taken place over the past year and a half for facility upgrades and updating of signage on our campus. And that's it, and I'll stop here and hand it over to Melanie. Thank you, everybody.
Thank you, Wafaa. Good afternoon, everyone. I'm going to just share a couple of very brief slides, hopefully to address some of the questions that have come up. The first is around our data and what is shared. Please go to covid19.columbia.edu. Every week, we update the metrics regarding on-campus cases detected through our testing, off-campus reports of test positivity, our random surveillance. It's all on the homepage of covid19.columbia.edu. That same page also has the monitoring plan that you've heard about. And if you click on that, you can see the details of the monitoring plan. There were a lot of questions about that. I just wanted to focus today on testing because there have been a number of questions coming up around who is required to test, what is required for testing. The first element of testing is our gateway testing. This is re-entry testing. It's just the first test you have through our program, and that's required for anyone who has not been on campus in 2021. So if you've been here through the spring or through the summer terms, you don't need to redo this test, but if you haven't been on campus, you do need to get this test. We recommend you get this test prior to September 9th. It's going to be the easiest time to get it. But you can't, if you're not coming back till later in September, you can do it in September, just right before coming back. You do need to schedule an appointment for that test, and it can only be done at one of our testing sites. We have the two large-scale testing sites, one at the Morningside campus in Lerner Hall, the other at the CUIMC campus in the Black Building. We also have a small amount of availability at West 51st Street and Tarrytown, but very small availability. You need to schedule an appointment, and when you go on to the COVID-19 website under testing, you can click the link to schedule the appointment. But just so you know, the appointments are only available 7 to 10 days in advance. So I saw questions, people are looking for appointments for early September and are concerned. Don't worry, we just open the schedule up 7 to 10 days in advance, so they're not there yet. We have capacity to test 3,000 people a day, so we will not run out of appointments as you need them for your gateway testing. If you are fully vaccinated, you can access campus the same day if you get that test done prior to September 9th. But if you are not yet fully vaccinated, you do need to have a negative result prior to accessing campus. So again, please schedule an appointment for that, secure.health.columbia.edu. Then after that gateway test, we have a few different elements in our ongoing surveillance testing. We are all expected to continue to participate in surveillance testing as we go through the semester because it's really been the way we're able to monitor what's happening on our campuses. So in terms of what kind of testing we do, if anyone has an approved exemption from the vaccine, they are required to test once per week. Everyone who is vaccinated is part of our random sample. This means we take a random sample of everyone who has accessed campus. We send them an email, tell them they've been lucky enough to be selected, and give them a 2-week window within which to get tested. That is also required. If you fail to do any of the required testing, the checkbox about testing will be removed and you will not be able to access campus. We also have what we call supplementary testing. If you're identified as a close contact of someone who tests positive, if you're required to test either before or after travel, you can do that testing through our program as well. We also have a very robust wastewater surveillance testing in our undergraduate residential buildings. And if we detect a spike, we test all residents of that building. And finally, as I think was mentioned previously, the voluntary testing remains available through September. Voluntary testing means if you haven't tested for any other reason and you just want a test, you can get that with a maximum of 1 test per week. I just want to end by saying that if we do detect a positive test, either through our testing program or if you notify us at covid-testtrace@columbia.edu that you've tested positive, our contact tracing team jumps into action. This team has been in effect since last summer and does highly rapid and robust contact tracing. They investigate the case, they identify any close contacts. Those close contacts are notified, and depending on their vaccination status, they are given information as to whether or not they need to quarantine and given guidance on when to test after the exposure. So we'll continue to do that. That will include classroom notifications if there is a positive test in the classroom, so that everyone who needs to have information about being a close contact will get it. With that, I am going to stop sharing and turn it over to David.
Thank you, Melanie. Just to quickly summarize our campus preparations for the fall term so that we can get to the Q&A. We've continued to provide for a safe campus through our enhanced cleaning protocols, air handling program that were put in place last year that follows CDC, government, and industry guidance, along with very valuable input from our public health team as well as faculty experts. In addition, there are enhanced transportation services we put in place with our intercampus shuttles, as well as new commuter and nighttime shuttle services, and also some additional space offerings in terms of outdoor space. And specifically, actions taken at buildings include building ventilation systems having been inspected, tested, confirmed to be fully operational, upgrading and confirmation that we have a MERV 13 or higher rated filter in place. This is the rating for filters that is recommended for treatment of air as it relates to the COVID-19 virus. And all the filters that needed to be upgraded were upgraded last year prior to the start of 2021 academic year. And we continue to monitor those, and we've increased our frequency of preventive maintenance on our building systems, which includes the replacement of these filters. We've also worked with CU faculty that has experience in aerosols to measure airflow and calculated airflow changes or air changes per hour in classrooms and research spaces, larger spaces, to confirm that they meet industry requirements for air changes per hour. And in the very few cases that we've come across that where we've needed supplemental filtration, we've provided portable HEPA filters to supplement the airflow there. Building systems, plumbing systems have been flushed and checked, fire safety systems tested, hand sanitizer stations in building lobbies and other high traffic spaces have been installed. Daily cleaning of classrooms, high touch public spaces twice daily, and we've converted restroom fixtures to touchless use as well. Each building has a building readiness checklist. It's posted in the building's lobby. All of these measures in the building checklist is available on the website. And there's also a video that you can look at that highlights preparations for the coming fall term that were also used last year. As it relates to transportation, the intercampus shuttle, the weekday service that we have, has been extended down to 96th Street to capture folks farther south from campus. And our Saturday service will resume on September 4th. Our regular service continues for Lee and Lamont. And we have launched a commuter shuttle during the pandemic, and that will continue service during the fall semester. Operates on weekdays with a heavy focus on common commuting times. It serves high-density areas in the Bronx, Brooklyn, Manhattan, and Queens. Seats can be reserved in advance. The fare is $4.50, and there's a lot more information about this, including the routes, on the transportation.columbia.edu website. One other transportation enhancement that we've done is the public safety evening shuttle has been upgraded, and it's now operated by VIA for Morningside Heights and Manhattanville campuses, and it offers on-demand point-to-point transportation, during the evening hours, starting during the academic year at 4 p.m. 7 days a week. And you can go to the transportation website and look up how to download the VIA app and get access to the evening shuttle there. The last thing I want to touch on before we move to the Q&A is that for our outdoor spaces, we do have 2 tented spaces that are available to the university community at Dodge Plaza and also in front of John Jay Hall. There's also a very large open tented space on Ansel Plaza. That's the large hardscape that is outside of the International Affairs Building. And we're going to be putting a additional tent on Hamilton Lawn. And during the Q&A or Amador, if there's anything you want to supplement in terms of outdoor spaces, I'll turn it over to you. And with that, Donna, you can move to the Q&A.
Thanks, David, and thanks everybody. Amador, I didn't know if you want to, we have been working closely across multiple campuses to make sure that the ventilation, some of the transportation options and so forth are covered. Amador, anything you want to mention? I know we just recently today agreed to add some additional tents, as I know the Morningside campus is going to do, but I want to turn it over to you as well to talk about the CUIMC campus.
I think many of the programs that David outlined, we've mirrored up here at the Medical Center campus. Most of our buildings, the HVAC systems are relatively new, so we were able to reprogram them to have 100% outside circulation. We've been doing that for over 1.5 years. We are working on adding some additional tents near the School of Public Health. We're working on a plan to significantly increase the amount of outdoor tables and chairs, both on Haven Plaza and by the VEC building, the Evangelist Education building. All of this information that David talked about can be found on the facilities website. I would strongly encourage people to go there. And it also includes the building readiness checklist for each particular building. That's the best source of information.
Great, thank you, Amador. There are over 350 questions that we've gotten. We've been furiously typing away to try to answer many of them. And apologies, I think a small number of you still had problems with the survey, so we apologize for that. But the data was very rich and very helpful. And as you've begun to hear, some of the campus preparation items are what we want to focus on. There have been a lot of questions that if you go, and Robert put it into the Q&A section, the most reliable and up-to-date source of information is the COVID-19 website. So whether you're concerned about visitors who are coming into the campus, whether you want to know about international travel, or even the campus preparations, it's all there. There are some tremendous frequently asked questions, as well as some of the data that Melanie showed on testing and all of our protocols. So please continue to do that. Wafaa, there have been a number of questions about physical distancing or 6-foot distancing, which we have been maintaining on campus. And the questions run along the lines of, why is it that we are going to end 6-foot distancing?
Yeah, and I think the answer is that now we have in place vaccination, which I think is very important. We did not have that before during the period of time when we had only really the masking as well as the testing and so on as our main safeguards. So I think the addition of vaccination has really transformed the way we think about our protective measures. Certainly we are keeping in place the indoor masking as an additional protection, but based on what we know and what the recommendations are at present is that if people are, again, largely a community of vaccinated individuals, largely a community of vaccinated individuals will be, as well as with the masking, which will prevent, even if that vaccinated individual has SARS-CoV-2, using masks by everybody will minimize the risk of transmission. So that's the reason, Donna.
Great. A question that's related to that is that one of the individuals on the president's COVID task force has advocated that we go back to, and you remember there was a period of time where N95 masks were in high demand, clearly used in healthcare settings, but generally not in others. But the question is, do we really need to go back to, or should we have an N95 mask wearing policy at Columbia?
There's no reason to do so. That the evidence does not support that. If you walk into hospitals today and clinics, the vast majority of individuals are not wearing N95 masks. They're wearing surgical masks. To just keep that in mind. And we've had a safe environment there. I think the N95, again, should be again restricted to situations where you are doing medical procedures and the risk is extremely high. It's also, for any of you who've had to use an N95 mask, and I have had to do so, it is extremely uncomfortable to wear an N95 mask all the time. So that's the reason why we are not requiring N95 masks. If anybody wants to to get an N95 mask and wear it, they're welcome to do so, but we don't believe that it is necessary to do so for most of our community.
Great, thank you. David, there are a number of comments about transportation. One is, if you could just reiterate the commuter shuttles that we've been supporting, will they continue into the fall? And just, I think, generally making people aware of that as an alternative to public transit, or at least a way to cut down on the length of the public transit commute.
Yeah, so if you go to the transportation.columbia.edu website, you can find information for our commuter shuttles. They operate from the 4 boroughs with stops in areas where there's good other transportation linkages or where we have concentrations of population. They run during commuting hours, and again, they're a good alternative to public transportation for farther out in the boroughs. So it's running from the Bronx, Queens, and Brooklyn, and then also up through Manhattan.
Great, thank you. Gerry, we have a number of questions about flexible work arrangements and, what flexibility there is for someone to request that and how they would go about doing that. Not necessarily because they don't want to be vaccinated and comply with the requirements, because of other concerns, whether it's travel, it's family members at home who are unable to be vaccinated or who are vulnerable. Could you talk about what the return to work or our new work environment policy is with respect to flexibility to work at home?
So we approach the new work environment conversation with the understanding that there are really 2 different inquiries here. One is a question of which jobs can be done remotely very effectively and which jobs need to be done in person. And that's a determination that's made unit by unit across the university, looking at their particular circumstances and needs. And it's not really employee specific, it's job specific. It looks at the function and asks, what does that function require? So many of you, I think, have been told that you can now work remotely several days a week because that's consistent with the way that function is being handled. There is a separate process that comes after that first determination. If your job doesn't really work for you, if you need a special accommodation, then we still have, as we've always had, the opportunity to ask for a flexible work arrangement through the leave management office. And you can find out about that by consulting with your local HR people or by going to the HR website. But that, it's not automatic. It's not something that's just available for the asking, but units are working hard to try and accommodate the needs of individual employees.
Thank you, Gerry. I'm trying to summarize 256 questions into a few categories, if I could. And one is reassurance about the booster. And we also have some questions about the flu, and I think both Melanie and I can address those. So we have to wait right now while the president made an announcement last night about the likelihood that booster shots will be made available for healthcare workers, for people who got vaccinated 8 months ago, which in many cases is in fact healthcare workers. Beyond this category that Wafaa described, the immunocompromised, there is likely an expansion. That does not mean that we're going to do it today. We can't by the guidance from the CDC as well as from New York State. As soon as we get that guidance, which people are predicting will be by mid-September, perhaps, we will begin doing booster shots. We also, every fall, do flu shots. And so one of the questions is, will we be doing, there's a couple questions about flu shots and about timing and putting them together. And in fact, it is sound to give you both at the same time. And Melanie, can you just give us a sense of how, you'll manage that at Learner, and we'll be also doing that up at the Black Building and in our practices.
Sorry, in terms, I'm so busy answering
The
questions.
flu shot, giving the flu shot and the COVID booster.
Yeah, so a lot of it's going to depend on timing when we actually get the true guidance. We are able to expand our capacity to give vaccinations. We have done mass flu vaccination campaigns in the past, so we're ready to do that. If the timing works out and we can give both at the same time, we'll do that. Otherwise, we will run our flu fairs as we've done in the past and our COVID booster fairs once booster shots become available. So we're ready to expand capacity. This is something we've done before.
Right. David, a question for you, which is maybe a little out of your field, but I'm going to ask you to take it, which is wearing a mask while you're teaching, or it can also be difficult for people to hear. Are we going to be able to provide microphones for faculty who are teaching who prefer to keep their mask on while they're teaching? As I said, we are going to allow faculty who can maintain 6-foot distancing in a classroom to be able to take their masks off, but if they prefer but need some other support, will we provide that support? And in some cases, the nature of students who are wearing face coverings will create muffled sounds, and so are there hearing aids or supplements that we could provide in a classroom where needed?
So that's, I know that CUIT is working very closely on classroom technology and outfitting the classrooms. They have outfitted the classrooms with various new presentation materials, hybrid technology upgrades. So we'll bring that back to CUIT to work with departments and the registrar to see what we can do.
Great, thank you, thanks. And we'll take that back. It's the first time we've really heard that, although not surprising, so thank you. There's a question about the Columbia Reopen Pass, and that Reopen CU Pass is intended to signal whether or not you can have access to Columbia facilities. It's not relevant off campus. However, there are 2 apps that you can download, and we want to encourage people to use these. One is the Excelsior Pass. So if you got vaccinated in New York State has that information, and you can download that for other social venues. And then there is the New York City COVID Pass, which just came out and is effective yesterday, that also similarly allows you to do that. Wafaa, a question about appropriate distancing in the classroom. Is there such a definition, and are we maintaining some way of measuring distancing in the classroom?
We are not at this point in time recommending that there be distancing in the classroom at this point in time. So just let everybody be aware of this. Yeah.
Great. Gerry, I'm going to turn it back to you for some wrap-up remarks. We have a lot of questions that are still open that we'll try to get to. I know one of them was a comment about testing, and while both the Black Building and Learner Hall have a lot of capacity, we can't control bunches of crowds that come in for testing. So please be patient. We've been operating for well over a year now, these testing facilities at great efficiency, and we'll continue to do so. But there is no question that in the next several weeks, with the crush of students coming back, there could be a little bit longer wait times. So with that, Gerry, I will turn it back to you to give us some concluding remarks.
So Donna, just before conclusion, I noticed there was a question there about the drugstore test kits that are available, these antigen tests, which I know that the 3 of you have, I've heard you recommend them. So could I just put that, you like those tests, right? That those are generally pretty good?
So those are good in those with symptoms.
Yes.
Right.
Only in those with symptoms,
Yeah.
they perform well. People without symptoms, they do not perform well.
Okay, That's interesting. All right. So, I mean, this is just incredibly impressive how many of you came to this session and how many questions there were. And we know that isn't completely good news. We know that it reveals how interested you are, but also that there's a lot of concern about what's ahead. We're not going away. We'll be back. We didn't answer all of the questions, although quite an astonishing number were answered here. I think I see 167, 168 were answered. But we'll follow up with these on the website with the Q&A. If some of the material in the presentation went by too quickly and you want to hear it a little more slowly, remember that all these sessions are recorded and that you can listen to them there. And we urge you to do that. And just one final message from me. We didn't talk too much on this conversation today about the mandate, the vaccination mandate, and what happens to those people who have not complied. We have had remarkable, just remarkable success with our vaccination mandate. And I'm hopeful that we'll be able to get all of those numbers out in the next few days. I think they will be very reassuring to everyone who comes onto our campus about how safe it's going to be. But just a plea to any of you on this call who are not vaccinated, it's not too late. There will be consequences, but it's not too late. So please, if you're not vaccinated, if you've been hesitant, get yourself vaccinated. It's good for you. It's good for the rest of the community. But let's pause here with thanks again to all of our panelists, but especially to Donna and Wafaa and Melanie, who, as from the beginning of this whole epidemic, have done so much to keep us safe. We'll be back again before very much longer. We look forward to continuing the conversation with you. Thanks all.